I'm back. How have you been? Today we're going to talk about a little bit about healthcare and a little bit about my job. So, in healthcare, many years ago in 1999, to Air's Human report came out and said people are dying due to medical errors. At least 90,000 people a year are dying because of errors. That's when they started pushing for quality in 1999. 15 years later, John Hopkins did a study showing that in 2015 that it's up to 250,000 people. And I truly believe that's underreported because hospitals only have to report medical errors, deaths related to medical errors, if they for sure know it was because of a medical error. It is totally underreported. It's probably higher than that. And they're saying now, even with my theory of the underreporting, it's the third leading cause of death in the U.S. We have to do something more about it, and we have to improve healthcare. And many other industries are already high reliable, and they have very few errors. Could you imagine if the airline industry killed that many people, had that many crashes a year? Nobody would fly. And they have such a high reliability organization. They have robust process improvement programs. They have Lean Six Sigma. They're very data oriented. They use this technology. Healthcare doesn't. Why is it different when we're looking at people's lives? But it is, and we have to do something about it. How do we force more organizations to use more complicated PI methodologies, performance improvement methodologies? I try teaching this. I teach this to whoever, some organizations that do want the training. I do train them in different organizations. I've even trained in Lean Six Sigma outside of healthcare. But we need to incorporate it more. But sometimes when I go into like an organization and I talk to them about it, they're like, no, we don't have time for that. We have all these other things we got to do. We can't carve out a day full of training. And I'm like, okay, you need to carve out this because you're going to keep putting out fires if you don't take a step back and put hardwire good processes that are fail proof. Invest in the technology, because if you truly do a ROI or a cost benefit analysis on it, it will outweigh what it happens. It will outweigh the cost. But it's so hard because healthcare they don't have all the time a lot of hard costs when they're looking at quality and prevention mechanisms. That's a lot of soft costs. And so you really have to try to say, okay, we're going to prevent this many infections or this many falls or whatever, and this could cost us this much, so it's saving us this much. And whenever COVID hit, I was the only PI director for many hospitals. But quality is not a revenue generating department. So they let me go. And it was a blessing in disguise, don't get me wrong. I'm glad I got let go because I'm in a much better place right now. But it got me thinking, when a pandemic hits and you got to change processes and you got to try to safely put things in place and help now nurses and healthcare personnel, EVS, I don't care what you do in healthcare, you're going to be working more with less. So now, then is the more of a reason to have performance improvement within the hospital. And that's the jobs they let go. And I understood why, because they need the front line. They can't let go of nurses or doctors or cleaning or the housekeepers or dietary or what, any of those type of jobs. But healthcare needs to think more about performance improvement. And how do we enforce it? Because the government, CMS, is already penalizing or incentivizing hospitals based on quality. They even have the star ratings based off of patient experience. They have a separate star rating just for that. Then they have an overall star rating based off of quality metrics. And some hospitals even do the leapfrog, which is a grade A through F based off of quality metrics. But regardless, even the one-star hospitals, what's the true incentive? There needs to be something else that we need to put in place. The government needs to push more on more robust process improvement. They'll come in when they survey and they'll look at your PI and they'll make sure you do an FMEA, which is a proactive tool. The failure modes effect analysis is a proactive tool. One is required every 18 months with Joint Commission. Why? It's a proactive tool. It should be required. More should be required. In other industries, FMEAs are required a lot more. They do many FMEAs. In fact, when I worked at a non-healthcare facility, they required FMEA on every single process. Why is it different in healthcare? And that's why we have so many inefficiencies. And whenever you mention a checklist, oh my gosh, people just look at me like I'm crazy, or, oh, not another checklist, what the heck, we're not going to use them, these aren't any good, etc., etc. But I always give this example. Look at all the other industries. And I give them the example of the airline industry and the movie Sully. I always say, what was the first thing that co-pilot did whenever they hit the bird strike? They pulled out the checklist. They had a checklist for any possible emergency. And it's not like a bird strike was frequent. So, but they probably did an FMEA on everything. Develop a checklist that any potential risk could happen. This is what you do. That's where we need to be in healthcare. And I don't know how to get there, but one day I am going to push more PI. I'm going to push more data. That's the other thing. And with data, I've tried implementing more robust charts. They refuse to look at the high variation charts that I produce, and I look and I do the data analysis, and they don't want it. They say, I want my bar charts, I want my dashboard, which is good, that's a snapshot, but it's a snapshot in time. It doesn't tell me anything other than what you're doing right now, and maybe if you improved or decreased from the previous month. Otherwise, how do you really know you're improving? And many times people look at that dashboard and it'll go from red in one month and green in the next, and like, oh, we've improved, we did good. Okay, maybe. You don't really even know, because you need you need to look at more months. It could have been a fluke that month that you improved, but you got to understand why you improved that month. Otherwise, you're going to continue doing what you've been doing, and it could have been just a fluke, something minute happened, and then you're going to go right back to not, because you don't know why you improved or why you took a decrease. And if you don't understand your data, it's going to happen. So if you work in healthcare, I would highly encourage you to really start implementing more robust performance improvement and using the Lean Six Sigma. And I can help in any way. I am a master black belt, and I can help train. But yeah, so if you work in healthcare, please help me on this journey to make improvements. And if you liked this video, like and please subscribe to my channel. I also do the makeup channel, but I'm also going to be doing a little bit of this in the future. So thank you for listening. Talk to you next time. Bye.